If you're over 60 and taking multiple vitamins, what I'm about to tell you could save your life. There are 3 specific vitamin combinations that millions of seniors are unknowingly taking together that can be not just ineffective, but actually dangerous, especially as your body's ability to process and eliminate nutrients changes with age. You might think that more vitamins equals better health, but when it comes to these particular combinations, you could be setting yourself up for serious health complications, nutrient toxicity, or even life-threatening interactions. The scary part? Most doctors don't warn you about these dangerous combinations, and many popular multivitamins contain these exact problematic pairings. Today I'm going to reveal the 3 vitamin combinations that can become toxic after age 60, explain exactly why your aging body processes them differently, and show you the safe alternatives that will give you the benefits you're looking for without the hidden dangers. This isn't scare tactics, this is critical safety information based on the latest research about how vitamins interact in the aging body. Why vitamin safety changes dramatically after 60. Before we dive into the dangerous combinations, it's crucial to understand why vitamin safety becomes so much more complex as you age. Your body at 60 plus processes vitamins completely differently than it did in your younger years, and ignoring this fact can lead to serious health consequences. Your liver's declining processing power. Your liver is responsible for processing and detoxifying everything you consume, including vitamins. After age 60, your liver's processing capacity can decline by up to 40%. This means vitamins that were once safely processed and eliminated can now build up to toxic levels in your system. Reduced enzyme production. Your liver produces fewer of the enzymes needed to break down and metabolize certain vitamins. Fat-soluble vitamins, A, D, E, K, are particularly problematic because they're stored in your liver and fatty tissues rather than being easily eliminated through urine. Slower clearance rates. What used to take your body 24 to 48 hours to process and eliminate might now take 72 to 96 hours or longer. This slower clearance means that if you're taking certain vitamins daily, they can accumulate faster than your body can eliminate them. Compromised detox pathways. The cellular pathways your liver uses to neutralize potentially harmful substances become less efficient with age, making you more vulnerable to vitamin toxicity. Kidney function changes. Your kidneys play a crucial role in eliminating water-soluble vitamins and maintaining mineral balance. After 60, kidney function typically declines, even in healthy individuals. Reduced filtration rate. Your kidneys filter blood more slowly, which means water-soluble vitamins that should be easily eliminated can build up to problematic levels. Mineral imbalance risk. Your kidneys become less efficient at maintaining proper mineral balance, making certain vitamin-mineral combinations potentially dangerous. Medication interactions. If you're taking medications, which most seniors are, your kidneys are already working harder to process these drugs, leaving less capacity for handling high-dose vitamins. Digestive system changes. Your digestive system's efficiency changes significantly after 60, affecting how vitamins are absorbed and utilized. Reduced stomach acid. With 40% less stomach acid production, some vitamins are absorbed more slowly, while others may be absorbed in larger amounts than intended. Altered gut bacteria. Changes in your gut microbiome affect how certain vitamins are metabolized and can create unexpected interactions. Slower transit time. Food and supplements move more slowly through your digestive system, increasing absorption time and potentially leading to higher than intended vitamin levels. Dangerous combination number 1. Iron plus vitamin E plus vitamin C, the oxidative storm. This is perhaps the most common and dangerous combination that seniors unknowingly take, often found together in multivitamins marketed specifically to older adults. The interaction between these three creates what researchers call an oxidative storm that can damage your heart, brain, and other vital organs. Why this combination becomes toxic after 60. Iron accumulation problem. After menopause in women and with age in men, iron begins to accumulate in the body because you're no longer losing iron through menstruation or rapid growth. Taking supplemental iron on top of this natural accumulation can lead to iron overload. Vitamin C's dark side. While vitamin C is generally beneficial, when combined with excess iron, it becomes dangerous. Vitamin C enhances iron absorption and can convert stored iron into a highly reactive form that creates harmful free radicals. Vitamin E. Paradox: vitamin E is supposed to be an antioxidant, but in the presence of excess iron and vitamin C, it can actually become pro-oxidant, meaning it promotes rather than prevents cellular damage. The cascade of damage. When these three vitamins interact in your aging body, they create a destructive cascade. Vitamin C increases iron absorption by up to 300%, overwhelming your body's ability to safely store it. Excess iron generates hydroxyl radicals, the most damaging type of free radicals. Vitamin E becomes oxidized in this environment and loses its protective properties. The combination attacks cellular membranes throughout your body, particularly in your heart and brain. Real-world consequences. Research has linked this combination to several serious health problems in seniors. Increased heart disease risk. A study of 1,800 seniors found that those taking iron plus vitamin C plus vitamin E had 40% higher rates of cardiovascular events compared to those taking these vitamins separately or not at all. Accelerated cognitive decline. The oxidative damage from this combination particularly affects brain tissue. Seniors taking this combination showed faster rates of memory decline and increased risk of dementia. Liver damage. Iron accumulation in the liver, accelerated by vitamin C, can lead to liver fibrosis and increased risk of liver disease. Increased cancer risk. The oxidative stress from this combination has been linked to higher rates of certain cancers, particularly colorectal and liver cancers. Hidden sources of this dangerous combination. Multivitamins. Many senior-focused multivitamins contain all three of these vitamins in significant doses. Fortified foods, breakfast cereals, energy bars, and nutritional drinks often contain this combination. Separate supplements. Taking iron for anemia, vitamin C for immune support, and vitamin E for heart health simultaneously creates this dangerous interaction. Prescription interactions. Some prescription medications contain iron, which can interact with vitamin supplements you're taking separately. Safe alternatives. Instead of iron, have your ferritin levels tested first. Most seniors don't need supplemental iron. If you do need iron, take it separately from vitamin C and E, preferably with food to slow absorption. Instead of high-dose vitamin C, get vitamin C from food sources like citrus fruits, berries, and vegetables. If you need supplemental vitamin C, take no more than 200 to 500 milligrams daily, and never with iron. Instead of synthetic vitamin E, use mixed tocopherols, natural vitamin E, in doses no higher than 200 IU daily, and take it at least 8 hours away from any iron supplements. Dangerous combination number 2, calcium plus magnesium plus vitamin D, the kidney stone factory. This combination is heavily marketed to seniors for bone health, but when taken together in high doses, it can create a perfect storm for kidney stones, cardiovascular problems, and dangerous mineral imbalances. Why this bone health combination backfires. Calcium absorption. Overload. When you take calcium with vitamin D, absorption increases dramatically, sometimes by 500% or more. While this sounds good for bones, it can overwhelm your body's ability to properly utilize the calcium. Magnesium competition. Calcium and magnesium compete for absorption. When taken together in typical supplement ratios, often 2 to 1 calcium to magnesium, the magnesium absorption is severely impaired, creating a functional magnesium deficiency even while supplementing. Vitamin D. Amplification. Vitamin D doesn't just help calcium absorption, it forces it. In the presence of high-dose calcium supplements, vitamin D can push calcium absorption to dangerous levels. The mineral imbalance cascade. This combination creates a domino effect of mineral imbalances. Excess calcium absorption overwhelms your body's regulatory systems. Impaired magnesium absorption leads to magnesium deficiency despite supplementation. Calcium deposits in soft tissues instead of bones, including arteries, kidneys, and joints. Vitamin D receptors become less sensitive due to mineral imbalances, reducing the vitamin's effectiveness. Serious health consequences. Kidney stone formation. The combination of high calcium intake with vitamin D dramatically increases kidney stone risk. Studies show a 17% increase in kidney stone risk for every 1,000 milligrams of supplemental calcium consumed daily. Cardiovascular calcification. Excess calcium doesn't go to your bones when magnesium is deficient. It goes to your arteries. This arterial calcification increases heart attack and stroke risk by up to 30%. Bone health. Paradox. Despite taking bone health supplements, this combination can actually weaken bones because magnesium deficiency impairs bone formation and calcium utilization. Kidney function. Decline. The kidneys work overtime trying to maintain mineral balance, which can accelerate age-related kidney function decline. Research findings. The Women's Health Initiative study. This massive study of over 36,000 postmenopausal women found that those taking calcium plus vitamin D supplements had higher rates of kidney stones and cardiovascular events, not lower. European Heart Study. Following 24,000 adults for 11 years, researchers found that those taking calcium supplements, especially with vitamin D, had 86% higher risk of heart attack. Bone density paradox. Multiple studies have shown that countries with the highest calcium supplement intake often have the highest rates of osteoporosis, suggesting that the calcium-magnesium-vitamin D combination isn't working as intended. Hidden sources and common mistakes. Complete. Bone formulas. Many bone health supplements contain this exact combination in problematic ratios. Calcium-fortified foods plus supplements, drinking fortified milk, or eating fortified cereals while taking calcium supplements can push intake to dangerous levels. Timing errors. Taking all three together maximizes the problematic interactions. Dosage miscalculation. Many seniors take multiple products containing these nutrients without calculating total daily intake. Safe alternatives. Calcium strategy. Get calcium from food sources first: dairy, leafy greens, sardines. If supplementing, use no more than 500 milligrams at a time and never with magnesium or vitamin D. Magnesium priority. Take magnesium glycinate or magnesium malate, 300 to 400 milligrams, at least 2 hours away from calcium. Magnesium is often more important for bone health than calcium in seniors. Vitamin D timing. Take vitamin D3 1,000 to 2,000 international units with a meal containing healthy fats, but not with calcium or magnesium supplements. Better bone health. Focus on vitamin K2, boron, and weight-bearing exercise along with properly timed individual minerals. Dangerous combination number 3, B6 plus B12 plus, folate in high doses, the nerve destroyer. This combination is often recommended for heart health and cognitive function, but when taken in the high doses commonly found in supplements, it can cause permanent nerve damage and increase cancer risk in seniors. Why B vitamins become dangerous in combination. Synergistic toxicity. While individual B vitamins are water-soluble and generally safe, when taken together in high doses, they can create synergistic toxic effects that wouldn't occur with individual vitamins. Age-related processing changes. Your body's ability to convert these vitamins into their active forms declines with age, leading to accumulation of inactive forms that can become toxic. Methylation. Overload. All three vitamins are involved in methylation, a crucial cellular process. Too much methylation activity can be as harmful as too little, especially in seniors whose methylation systems are already compromised. The specific dangers. Vitamin B6. Toxicity, doses above 100 milligrams daily, common in B-complex supplements, can cause permanent peripheral neuropathy, nerve damage that starts in hands and feet and can progress throughout the nervous system. B12 overload. While B12 deficiency is common in seniors, excessive B12, especially when combined with folate, can mask serious underlying conditions and may increase cancer risk. Folate interference. High-dose folate can mask B12 deficiency symptoms while allowing the neurological damage to continue and may accelerate growth of existing cancers. The neurological damage process. When these three B vitamins are taken together in high doses, they create a toxic environment for nerve cells. Excessive methylation activity disrupts normal cellular processes. Vitamin B6 accumulates in nerve tissue, causing direct toxicity. Folate masks B12 problems while neurological damage continues. Nerve cells become overstimulated and eventually die. Research documented consequences. Peripheral neuropathy. Studies show that 25% of people taking high-dose B6, over 100 milligrams daily, develop peripheral neuropathy within 2 years. When combined with B12 and folate, this risk increases to over 40%. Cognitive acceleration. Paradoxically, while low doses may help cognition, high doses of this combination have been linked to faster cognitive decline in some seniors. Cancer risk. The large-scale Norvit study found that men taking high-dose B6 plus B12 plus folate had 21% higher cancer incidence and 38% higher lung cancer risk. Cardiovascular paradox. Despite being marketed for heart health, several studies have found increased cardiovascular risk with high-dose B vitamin combinations. Hidden high-dose sources. B-complex supplements. Many contain 50 to 100 times the RDA of these vitamins. Energy drinks and shots often contain massive doses of B vitamins. Fortified foods, cereals, bars, and drinks can add significant B vitamin doses. Multiple supplements, taking separate B6, B12, and folate supplements along with a multivitamin can create dangerous dose stacking. Safe B vitamin strategy. B6 limit. Never exceed 25 milligrams daily and ideally stay under 10 milligrams unless medically supervised. B12. Precision. Have your B12 status tested first. If deficient, use 1,000 micrograms daily until levels normalize, then reduce to 250 to 500 micrograms for maintenance. Folate caution. Use no more than 400 micrograms daily unless specifically prescribed. Always ensure adequate B12 status before supplementing with folate. Timing. Separation. If you need all three, take them at different times of day to reduce synergistic effects. How to audit your current supplement routine. Now that you know the dangerous combinations, here's how to audit your current supplements to identify potential problems. Step 1. Complete inventory. List everything, include prescription medications, over-the-counter supplements, multivitamins, fortified foods you eat regularly, and any powders or drinks. Check labels carefully. Look for the exact forms and amounts of each vitamin, not just whether they're present. Calculate total daily intake. Add up all sources of each vitamin to get your true daily intake. Note timing. Record when you take each supplement to identify problematic combinations taken simultaneously. Step 2. Identify dangerous combinations. Red flag combinations. Look for any supplements that contain the 3 dangerous combinations we've discussed. Hidden sources. Check multivitamins, meal replacement shakes, and fortified foods for these combinations. Dose stacking. Identify where you might be getting the same vitamins from multiple sources. Timing conflicts. Note any supplements taken at the same time that could interact. Step 3. Risk assessment. High risk factors. Consider your age, kidney function, liver health, and current medications. Symptom check. Look for signs of vitamin toxicity you might have attributed to aging or other causes. Medical history. Consider conditions that might make you more vulnerable to certain vitamin interactions. Medication interactions. Research how your medications might interact with vitamin combinations. Step 4. Create a safer plan. Elimination strategy. Remove the most dangerous combinations first. Spacing protocol. Space out vitamins that can interact when taken together. Dosage reduction. Lower doses to safer levels, especially for fat-soluble vitamins. Professional consultation. Work with a healthcare provider familiar with supplement interactions. Warning signs of vitamin toxicity you might be ignoring. Many seniors attribute symptoms of vitamin toxicity to normal aging or other health conditions. Here are warning signs that your vitamin combinations might be causing harm. Iron plus vitamin C plus vitamin E, toxicity signs. Unexplained fatigue and weakness, joint pain and stiffness, skin discoloration, bronze or gray tint, abdominal pain and digestive issues, heart palpitations or irregular heartbeat, memory problems or confusion, frequent infections despite taking immune-boosting vitamins. Calcium plus magnesium plus vitamin D, toxicity signs, kidney stones or frequent urination, constipation that doesn't respond to typical remedies, muscle weakness or cramps, heart rhythm abnormalities, confusion or mental fogginess, bone pain despite taking bone health supplements, high blood pressure that's difficult to control, high-dose B vitamin toxicity, signs, tingling or numbness in hands and feet, balance problems or unsteady walking, burning sensation in extremities, difficulty with fine motor skills, unexplained skin problems, sleep disturbances, mood changes or irritability. Safe alternatives that actually work. Instead of these dangerous combinations, here are evidence-based alternatives that provide benefits without the risks. For energy and vitality, instead of high-dose B-complex use, individual B vitamins in appropriate doses, B12, 500 to 1,000 micrograms, B6, 5 to 10 milligrams, folate, 200 to 400 micrograms, taken at different times. Add CoQ10, 100 to 200 milligrams, magnesium glycinate, 300 to 400 milligrams, vitamin D3, 1,000 to 2,000 international units. For heart health, instead of iron plus vitamin C plus vitamin E, use omega-3 fish oil, 1 to 2 grams EPA, DHA, magnesium, potassium from food sources. Add hawthorn extract, garlic, or Mediterranean diet pattern. For bone health, instead of calcium plus magnesium plus vitamin D together, Use vitamin K2 100 to 200 micrograms, magnesium glycinate 400 milligrams, vitamin D3 2000 international units, all taken separately. Add weight-bearing exercise, adequate protein, boron 3 to 10 milligrams. For brain health, instead of high-dose B6 plus B12 plus folate use, omega-3 DHA 1000 milligrams, phosphatidylserine 100 milligrams, lion's mane mushroom. Add regular exercise, social engagement, continuous learning. Creating your personal safe supplement protocol. Morning protocol, 7 to 8 a.m. Vitamin D3, 1000 to 2000 IU with healthy fats. Omega-3 fish oil, 1 to 2 grams. Probiotics if used. Midday protocol, 12 to 1 p.m. Magnesium glycinate, 200 to 300 milligrams. B12, if needed, 500 to 1000 micrograms. CoQ10, 100 to 200 milligrams. Evening protocol, 6 to 7 p.m. Remaining magnesium, 100 to 200 milligrams. Vitamin K2, 100 to 200 micrograms. Any remaining individual vitamins. Separation rules. Keep calcium and magnesium at least 2 hours apart. Take iron, if needed, separately from all other supplements. Never take high-dose B vitamins together. Take fat-soluble vitamins, A, D, E, K, with meals containing healthy fats. When to seek professional help. Consult with a healthcare provider immediately if you are currently taking any of the dangerous combinations discussed. Experience any symptoms of vitamin toxicity. Take more than 5 different supplements daily. Have kidney, liver, or heart disease. Take medications that might interact with vitamins. Are unsure about appropriate dosing for your situation. Consider working with a functional medicine practitioner or clinical nutritionist who specializes in supplement safety for seniors. The bottom line, less can be more. The most important takeaway is that more vitamins don't always mean better health, especially after 60. Your aging body processes nutrients differently, and combinations that might have been safe in your younger years can become dangerous. The 3 combinations we've discussed, iron plus vitamin C plus vitamin E, calcium plus magnesium plus vitamin D, and high-dose B6 plus B12 plus folate, are responsible for thousands of preventable health problems in seniors every year. By avoiding these dangerous combinations and following the safer alternatives and timing protocols outlined above, you can get the nutritional support you need without putting your health at risk. Remember, supplement safety isn't just about individual vitamins, it's about how they interact in your aging body. Take the time to audit your current routine, eliminate dangerous combinations, and create a safer, more effective approach to supplementation. Your health and longevity depend on making these changes now, before these toxic combinations cause irreversible damage. Critical disclaimer: this information is for educational purposes only and not intended as medical advice. Always consult with your healthcare provider before making changes to your supplement routine, especially if you have chronic health conditions or take medications. Some individuals may require specific vitamin combinations under medical supervision, despite the general risks discussed.